I'm Jordan, a level 1 nursing student. Can I get your FBAR report?
Sure. We have Shanaina O'Connor in room 231, a patient of Dr. Engelbert's. She is a 34-year-old full code. She came in with fever of an undetermined origin, and secondary diagnosis is end-stage renal disease. She does have an allergy to trimethoprim sulfamethoxazole. She complains of fever, chills, malaise. She's a type 1 diabetic with elevated blood glucose and decreased appetite over the past few days with minimal urine output. She does have a history of the renal failure, secondary diabetic neuropathy, and hypertensive nephrosclerosis. She is undergoing hemodialysis 3 times a week for 1 year. She is listed for a transplant 6 months ago. She also had a graft infection 3 months ago, resolved after antibiotics. She does have a history of recurrent UTIs. The AV graft is in the left forearm, no tenderness or drainage, skin is intact otherwise. She's alert and oriented ×3, no acute distress, appears a little uncomfortable. She does report tingling and numbness in her lower legs, and sensation is diminished. She denies any shortness of breath. She quit smoking 2 years ago. Chest expansion is symmetrical, and she does have clear lung sounds. She's tachycardic, regular rhythm, S1 and S2 present. She has slight 1+ non-pinning edema in the lower extremities. Femoral pulses are 2+ bilaterally and 1+ pedal pulses. Her cap refill is less than 4 seconds. Her abdomen is soft, round, non-tender. Bowel sounds present ×4. She does report weight gain 10 pounds over the past few weeks. No pain and regular bowel habits. She's on the renal diet, 1,500 milliliters daily fluid restriction. She reports the decreased frequency and volume of urine. It is more concentrated and darker in color. She denies any pain, burning, or difficulty. She's up, activity is tolerated. We're going to monitor I's and O's, notify the physician if temp is greater than 101 or her blood pressure is 180/100. She's on daily weights, and she'll be a sliding scale insulin with AccuChecks before meals and at bedtime. Her last set of vitals, her temp was 101.1, heart rate 95, SATI 96. Her blood pressure is 138/78, and we're checking vitals every 4 hours. Her last AccuCheck was 155. She does have the IV site right median vein. We're going to be starting the sodium chloride with the antibiotic imipenem with cilastatin. Her CBC is pending. Her comprehensive metabolic panel is pending. Her urinalysis shows increased white blood cells, and we're waiting on her culture and sensitivity to come back.
Why specifically is this client receiving this medication, and what action does the medication have on the body?
The client is showing white blood cells in the urinalysis and the increased temperature. So she's showing signs of infection, so we're giving the imipenem as a broad spectrum bactericidal until her culture and sensitivity results are back. The imipenem binds to the bacterial cell wall, resulting in cell death.
When should you question administering this medication? Does the medication have therapeutic serum level? What vital signs must be monitored, and which physiological parameters should be monitored as the medication is being administered?
We will question if there's hypersensitivity and renal impairment. If dialysis wasn't scheduled for her within the next 48 hours, I'd question giving the antibiotic. Also, patients with decreased creatinine clearance are at risk for seizures. Vital signs, we'll be monitoring all vitals, especially her temperature, blood pressure, pain, and heart rate. We'll monitor her urine concentration, color, any signs of anaphylaxis like rash, laryngeal edema, and we'll monitor her labs, BUN, AST, ALT, creatinine, hemoglobin, and hematocrit.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
We'll advise the patient to report any signs of superinfection like black furry overgrowth on the tongue, loose or foul-smelling stools, and allergy. If taken at home, we would instruct her to contact the provider if fever and diarrhea occur, and have her not treat the diarrhea without consulting the physician.
What are the side effects and potential adverse reactions?
Seizures, dizziness, hypotension, C. diff-associated diarrhea, nausea, vomiting, rash, pruritus, sweating, urticaria, phlebitis at the site, and of course anaphylaxis.
How will you know the medication is effective?
Her white blood cell count will decrease, and her temperature will decrease.
Okay.
Okay. So we're gonna go in and give Shanae O'Connor. So I'm just pulling her up here, double checking the meds. Sodium chloride 0.9% with the ibuprofen is due now. We'll be given that IV, checking her allergies, and I would check to make sure that the sodium chloride is compatible with the ibuprofen. Okay. So we're gonna go in, knock it out. Good morning.
Good morning.
My name's Andrea. I'm going to be your nurse today. What is your first and last name and date of birth, please?
Shanae O'Connor. I'm 34 years old.
Great. And do you have any allergies?
Yes. Trimethoprim and sulfamethoxazole.
Nice job. Are you having any pain?
No.
So I am here to start an antibiotic for you. Do you know why you're receiving this antibiotic?
No.
Where you're showing signs of infection with an increased white blood cell count in your urine and an increased temperature. So we're going to start imipenem. And when your culture and sensitivity report comes back, we'll change to a different antibiotic that's more specific. Okay, so I'm just going to check the patency of your IV site. I don't see any redness or swelling. Are you having any pain at the site?
No.
And does this burn?
No.
Okay, good. So, okay. We'll let that sit there. Okay, so we'll go ahead and hang your sodium chloride first. Let me scan your armband here. Again, I'm looking at Shanae O'Connor. Checking the allergies, checking the time, right patient. Getting out my sodium chloride, checking the bag, I don't see any holes, color's normal, checking the expiration date. Okay. So I'm going to go ahead and spike the bag.
tubing here. Okay, there we go. Tubing is primed. Still sterile. Can you hold that, please? Mm-hmm. Thank you. So, we're gonna get the normal saline started, double checking 30 milliliters per hour, double checking bag. So we're gonna hit channel select, guardrail IV fluids, 0.9% normal saline. Is this correct? Yes. The rate, 30 milliliters per hour. Volume to be infused, it's a 1,000 milliliter bag. We're going to set it for 950 so it doesn't run dry. And we'll get that started. Okay, so now we'll hang the pin. I'm going to go ahead and scan the patient. Pull out my medication here.
Let me know, okay? And what's your medication you're allergic to? What does that do to you? Okay, is there any other medication you're allergic to?
I'm going to go ahead and spike the bag. And prime my tubing. And it's primed. I don't see anything. Okay, so I have that hooked up. I'm going to set my channel here. This is going to be my secondary. And I'm going to go to imipenem and this is 500 milligram. Rechecking my bag. What's the duration?
Oh, so it's over 1 hour.
Can I see? I've never got to play with one of these.
As the nursing student, sure.
Yeah, I'm the nursing student.
Okay.
Can I push start?
Yep, over 1 hour. Okay. Okay. Alright. So, do you know any side effects that you should be looking for while receiving this antibiotic?
A rash?
And then if you have any breathing problems or changes in your heart rate or dizziness, just put your call light on. I did print out some education for you.
Thanks.
Is there anything else I can do for you today?
No, I have my call light.
Okay.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I reviewed the 5 rates, the patient drug dose time routes, checked for the allergies. I also checked the Y compatibility of the imipenem, cilastatin, and the normal saline. I checked the bags for any holes, discoloration, or an expiration date. Flushed the IV site to make sure it was pain, that there was no redness or swelling.
Did this information affect your decision to administer the medication?
Yeah, it allowed me to administer the medication appropriately and accurately by confirming all of the information.
Did this information affect how you administered the medication?
Just that I made sure that it was the Y site compatibility, and the patent IV allowed me to hang the bags and administer the infusion.
Okay, that's it.